Hello, welcome to the Community Collective Impact Model for Change on-demand learning event titled Creating a Data-Driven Strategic Plan. This learning event is presented by Ohio's CCIM4C Training, Technical Assistance, and Evaluation team. My name is Holly Raffel, and I will be facilitating today's learning event. The learning objective for today's event are for CCIM4C project directors to be able to first, articulate the connection between the theory of change, or vision, and the strategic plan. 2, to describe how a root cause analysis results in the creation of a logic chain to address community issues. And 3, recognize how a strategic plan grounded in a logic chain results in an outcomes-driven strategic plan. By now, the community scope of work should be very familiar to you, but it is always a good reminder to review it to keep us on track. As always, your participation in this learning event means that you are upholding activity number 1 in the scope of work. Please know how much we appreciate your engagement in Ohio's CCIM4C initiative. As we have discussed previously, the first deliverable that CCIM4C communities will submit, the theory of change, encompasses 4 of the 7 activities in the community scope of work. At our last face-to-face learning community, we described the theory of change as a vision. I still believe that the term vision is an excellent descriptor of this deliverable because we have framed opioid use disorder deaths as a wicked problem. This is because experience and research have shown that substance abuse problems are among the most difficult social problems to prevent or reduce. Experts also agree that substance abuse problems are usually addressed best in 2 ways. Some approaches to combat the opioid crisis may be most effective when implemented on a larger scale, perhaps through a statewide change in laws, for example, requirement of all Ohio school children to receive opioid prevention education in the school curriculum, or the implementation of a statewide system such as the Ohio Automated Prescription Drug Reporting System, or ORS, a tool to track the dispensing and personal furnishing of controlled prescription drugs to patients. Yet other approaches must be developed locally at the community level because substance abuse problems are often manifested locally. We know that to address the opioid crisis, communities must be empowered to use data to create a vision that is specific to their local conditions. When communities are able to coalesce around a clearly articulated vision, they have a roadmap to address the opioid crisis that can be understood by all members of the community. We discussed this graphic in detail at the January Learning Community meeting. You have all been working on mobilizing your community partners, what is noted in green on this slide, using the Thrive tools provided by Prevention Institute. Hopefully by now, your community has begun to develop the required subcommittees to examine data related to each of the 6 strategic plans. The goal for February is to identify the causal factors that your community has identified that contribute to opioid use disorder deaths and lack of access to opioid use disorder treatment, including medication-assisted treatment. This is noted in yellow on the slide. It is important that the causal factors are rooted in data, as this ensures that your community has an outcomes-based reporting system associated with its vision. In outcomes-based planning, we must begin with the end in mind. In our case, our end goal is to reduce opioid use disorder deaths and to increase access to treatment, including medicated-assisted treatment. Through research, we identified 6 opportunities to reach our end goal: prevention through supply reduction, prevention through demand reduction, prevention through death prevention in terms of naloxone, treatment, as well as recovery supports, and of course, our big, hairy, audacious goal, or BHAG. You are all working on identifying the causal factors in your community in each of the 6 plan areas that will have the greatest impact on the end goal. This graphic illustrates the logic chain that guarantees outcomes. We know that there is no magic wand to reach our end goal. If there was, we would have used it by now. So we break down that end goal into parts, in our case, the 6 plan areas. But we still are too broad. Within those plan areas, we need to know the root causes that will help us select the right evidence-informed strategies to use at the right time that are culturally relevant and a best fit for our community. When we select the appropriate strategies for our community within each plan area, those strategies will impact the root cause that directly impacts our causal factor. It is by impacting the causal factor that we will reach our end goal of reducing opioid use disorder deaths and increasing access to treatment, including medication-assisted treatment. Each piece is connected, and each piece is grounded in data so we can measure our outcomes. The heart of a good theory of change is linking the evidence-informed strategies that we select to the outcomes that we expect. The role of CCIM4C communities is to develop a comprehensive and strategic community plan based on local needs and resource assessment. Using the findings from the needs assessment, CCIM4C communities will develop a theory of change or vision specific to the community and its substance abuse problem. Each theory of change reflects and maps the local substance abuse phenomenon. An effective theory of change or vision may serve as the primary tool to guide the selection of evidence-based programs, practices, and policies to include in a comprehensive plan. The homework for the rest of February is to finalize those causal factors and ensure they are grounded in data. Why data? Because our next step will be to dig deeper. We will use more data to identify the root causes that have the greatest impact on our causal factors. Why dig deeper? Because that is how your community will select the most appropriate evidence-informed strategies to reach our goal of reducing opioid use disorder deaths and increasing access to treatment, including medication-assisted treatment. Hopefully, by the end of February, your community will be able to complete the green boxes and the yellow boxes on the theory of change or vision document. Then, in March, you can get to work identifying the root causes and selecting strategies. Because we have an abbreviated timeline, it is important to look ahead to the activities on the community scope of work that we haven't discussed yet. We have to keep our eye on the prize. The remaining two activities create deliverable number 2, the data-driven strategic plan. As we have discussed, each CCIM4C community will submit 6 data-driven strategic plans. We know that substance abuse problems require comprehensive solutions, a variety of intervention approaches directed toward multiple opportunities. We have discussed that the plans are not discrete plans. We certainly don't want to create silos. We do know that a division of labor, the creation of subcommittees, with shared leadership is essential to get this work completed on time. While subcommittees may work on the plan separately, it is important to remember that the plans are all really subplans associated with your community's theory of change or vision. Each CCIM4C community will submit a comprehensive strategic plan to reduce opioid use disorder deaths and increase access to treatment, including medication-assisted treatment. We will detail the full strategic plan during our virtual CCIM4C Learning Community meeting in February. However, we believe it's important for you to see it here. You also have a large version that you can print out. The good news is that while you are working on your theory of change, your vision, you are also working on your strategic plan. Note that that far right column outlined in red is your community's opioid use disorder outcome, and those have been gifted to us by SAMHSA. We just need to fill in the appropriate SAMHSA goal depending on the plan that we're working on. You are currently working on identifying and selecting causal factors for the 6 strategic plans. We have provided a workbook to support your community in doing so. Once you have completed your workbook and selected your final causal factor for each of the 6 plan areas, we will continue to develop them, and soon you will have completed the boxes outlined in blue. The blue box on the left is the causal factor data framed as a problem statement, and the blue box on the right is the same data framed as an outcome. This is the beauty of outcomes-based planning. The next step is to identify root causes, and we discussed this earlier in this online learning event. Not to worry about this now, this is just a preview. The green box on the left is the root cause data that we will develop, framed as a problem statement, and the green box on the right is the same data framed as the outcome. Again, isn't outcomes-based planning exciting? At least I get excited about the connections that come with a logic chain. Finally, we are able to use the data and our clearly identified outcomes to support us as we choose the right evidence-based strategy or strategies that best meet our community's needs in terms of outcomes, but also in terms of relevance and cultural fit. The last piece is our theory of action. We need to identify which of our partners will be implementing the strategy, the estimated budget, and the timeline. Don't you love it when a plan comes together? In all seriousness, the deliverables that your community needs to provide are as follows. The theory of change or vision, 6 strategic plan maps. Together, the 6 strategic plan maps will become your community's comprehensive, data-driven strategic plan to reduce opioid use disorder deaths and increase access to opioid use disorder treatment, including medication-assisted treatment. Moving forward. To help your community move forward, we have provided a handout or workbook titled Identifying and Selecting Causal Factors for the 6 Strategic Plans to help guide the selection of causal factors. You've been working on assembling the data in those Excel spreadsheets. These worksheets will help you take to the next level where you prioritize and your subcommittee select those causal factors for each plan. The next thing we'd like to have you do and your subcommittee leaders do is preview the strategic plan maps and familiarize yourself with the structure of them. It is important to note how the structure of the strategic plan map supports a logic chain leading to a comprehensive outcomes-based strategic plan. Finally, we invite you to engage in Prevention Institute's learning event to hear more about how to address that big, hairy, audacious goal, or BHAG, that your community is working on. Thank you. Working on the opioid crisis is hard, important work. Working together as a community is even harder and even more important. We appreciate all of the time, effort, energy, and hard work that you and your community are putting into the statewide collective impact model for change initiative. Thank you.